Well, listen, we've had some questions come up during the webinar. Let's jump into those and let's address those if you don't mind. Um,
Absolutely.
so let's see. A couple of them here. These are pre-submitted questions. These are ones that are submitted prior to doing the webinar. Um, my spine was broken at my C2, C1 and C2. I had surgery. Can cannabis help with recovery? I'm going to start with this one and then have you help me with this, Manny. I did not have a broken back, but I had severely herniated discs in my neck. Surgery was not an option for me because of the amount of seven herniated discs was not something the doctor wanted to take a risk at. And again, I have used cannabis to be able to address not only the pain but also the inflammation. Because anytime you have an injury, if you can reduce the inflammation, it will also reduce the pain. And I have used my regime because it's something that's not going to go away. I have a plan where when I wake up in the morning, I actually have, as I mentioned, I take some tincture drops and then hit a vape pen right away because within 2 to 3 minutes, I'll take my pain level from a 7 or an 8 down to a 1, which is important for me to start my day. Then I take a look at something in the early afternoon. Again, I use tincture drops and or gummies. And then early in the evening, I use, again, tincture drops or gummies. And then before I go to bed, I'm a chocoholic. So I tend to use some chocolate before I go to bed, about an hour or two before I go to bed to give me time for that to take effect. And the reason I do that is because the edible, that particular chocolate will last through the night. I'll get my 8 to 10 hours of sleep. So the answer is yes, I think it can help. Manny, your thoughts on this?
I would agree with you completely, Mark. We have a few products that would be beneficial. Before I go into that, I'd also like to speak on how this exactly was to my point on how the pain that you're experiencing will lead to the stress, the aggravation that could lead to PTS or anxiety disorder.
Yep.
So we definitely want to treat this first if we could. And we have a topical called the Fix. It's a 1-to-1 ratio, so 1 part CBD, 1 part THC, balm with high B caryophyllene, natural analgesic or pain relief, eucalyptus and mint that also opens up the pores so it gets in there deep for that deep joint pain. One of the rules that I like to tell people to go by is if you're buying a lotion, those are really great for muscle aches. If you want that deep joint pain, you want to go for a salve or a balm, and our 1-to-1, the Fix, is amazing for that. The other benefit of using a topical like that is it's great for sight. It doesn't get into the bloodstream. So you can also use a tincture, a gummy, or chocolate like you were describing, Mark. It's always great to go from different angles. Make sure you journal it, and you should be able to find that relief over time. However, you want to make sure that you continue with the CBD because most people don't use CBD enough. It doesn't really get to the source of the pain right away. You have to upload on it a little bit and build it up in your system, and you'll notice the use of THC will drop as you use CBD, and it'll become more of a use for when you're dealing with those significant pain, anxiety, or stress issues.
Sure. Good answer. Let's take on the second one. It says, does THC sometimes exacerbate anxiety and or bipolar disorder if the individual is not taking any RX or any pharma drugs for these issues? And a related question that we got is, I've heard that THC can make anxiety worse for some patients. Is this true? What is the probability? I think a lot of this is THC can make anxiety worse, but again, it goes back to you knowing your therapeutic dosing level for you yourself. If you're taking it and you have a level, for example, I'm very tolerant to THC. My wife is not. If I stay below that therapeutic dosing level, it really helps me. But once I go above it, it can in fact cause anxiety to come back. You want to address that, Manny, because I think that's really important.
It is. And one of the things that I tell people is not to concentrate on the THC as much, as long as you're going low and slow. For instance, microdosing with the mints at 2.5 milligrams, or taking our Wanna Chews, one of the only homogenized gummies out on the market in Florida, that you can actually cut in half and in quarters and microdose from 2.5 milligrams up to a 10 milligram gummy. What you do want to pay a special attention to is the terpene profiles, because regardless if it's a high CBD product like our 12.5 to 1 calm or a high THC product like our 1 to 9 relief, that the terpene profile is going to determine how that really affects you, which way the CBD and THC is going to drive the effect. So it's very important that you come in and have that consultation. There's really not a time limit on how our consultations work. However, we do try to minimize them for expedited purposes, obviously, but we'll take the time with you and sit down and go over those issues with you.
Sure, that's really there. So, okay, let's jump to the next one. What's the best CBD THC ratio and route and timing for de-stressing and better sleep? That's right up your alley.
It is, because that's one that I use that we went over a previous webinar. So for me particular, I like to use Surterra's 5-to-1 ratio serene Theragels. And the reason I use the Theragels over any gummies or any other product is because it breaks down in the gut, not the stomach, and you get about 90% absorption, which means more effective product and it lasts longer. It's great for, excuse me, anxiety, stress, clarity, and focus without a euphoric effect. I use it every morning, just about. And then usually around the afternoon time, depending if I'm working or not, I'll transition over to a 1-to-1, which is our Soothe. Great as a relaxant, spasticity. People actually regard it to a couple of glasses of wine, so great for social anxiety, and again, inflammation. And depending on how I'm feeling at night, usually I don't need anything stronger because I've mitigated throughout the day. But at night, if I need something to help me sleep because my mind is racing, I would step up to the 1-to-9 Dream. Now, 1-to-9 Dream is great to shut down the mind and kind of relax you down and help you sleep. It's a heavy or high THC product, so it will make you euphoric. But it's a great way to help you get to sleep more naturally than using some of the pharmaceuticals that are out on the market.
Cool, good. So next question is, does cannabis impact cortisol levels? And I should point out for people that don't know that cortisol levels are the blood sugar, the blood sugar in your body. So this is it affects the glucose in your body. And cannabis actually does have an effect on that. In fact, there's certain terpenes like humulin that can help reduce some of that blood sugar level. Your thoughts on that, Manny?
I don't know too much about it, and I can't speak on it medically. However, to your point on that, even some of the sugars and the chews, the chocolates and stuff like that, whatever fatty materials they're using. I like to point out that our Wana chews are vegan friendly. They're gluten free. They're made with pectin. They use tapioca syrup instead of raw sugar, and they are melt proof as well. So that might speak a little bit more to that point. But other than that, that's the extent of my expertise.
Yeah, I think the answer is I. There has been studies that show that medical cannabis can help with release with helping you control diabetes and the blood sugar level in your body. I don't think there's enough studies to say it's going to be the primary reason for that, but I know that I have been diagnosed with diabetes, and through exercise and medical cannabis, I've put the whole thing in control. So I would say try it, monitor it, and please make sure that you monitor it to make sure you get those levels into control. Because again, you don't want to live and have a diabetic life that can cause a lot of other problems that are out there. Cannabis, I should point out, is very personalized. It works differently for different people, just like alcohol, just like caffeine. You really got to find out what your level of tolerance is. I mean, I have friends who have one drink and they're done for the night. I have some friends who drink the whole bottle and they're just getting started. Cannabis is much the same way. If you're very tolerant to THC, you can take higher levels of that. If you're not, you got to take lower levels of that. And that's why ratio products are really important to pay attention for, to have what a ratio product. Now, what do you mean by ratio? How much CBD is in the product versus how much THC is in the body. So you'll hear something like an 8-to-1. That means that there's 8 CBD. The first number is always CBD. Second number is THC, or 2-to-1, or 4-to-1, or 1-to-1. Okay, so those are things that you need to pay attention to when you're looking at really dialing in a set of products for you yourself. The question here is, are there any Surterra strains or products focused on decreasing symptoms of ADHD and post-traumatic stress? I think we just did a webinar on this, but Manny, you may want to address this.
Yeah, I'd be happy to. So again, one of the main products, 5-to-1 Serene, is great for that ADHD during the day, even for PTS during the day. And then you could change it over to the Soothe. And now most of the times you'll hear me speaking a lot on the wellness line, ratio-based products. And the reason I do that is because a lot of the questions that come through are base level, trying to get started, trying to find the right regimen. And the best way to do that is with consistent products that don't always change from batch to batch. which our ratio products or our wellness line is. And once we find some products there that really work and make a difference, even slightly, then we can move over to our cultivars, our float line, our Galileo line, and so forth. So for this question, definitely 5-to-1 Serene, I would start out with 1-to-1 Soothe. And then if you need something a little bit heavier, I'd use the Dream at night. And during the day, I would have a consultation at one of our local stores to find a heavier product besides the 5-to-1, because the 1-to-1 Revive might be a little bit too much.
Sure. Okay. It's good advice. Great question here. Is there a particular strain terpene that has the same effect as Xanax, prescription medication for severe anxiety and depression? Look, cannabis works for anxiety and depression. And I think, Manny, you just put up a number of strains and terpenes that can help with that.
Yeah, the ones I mentioned, and then there is one in particular that I would actually recommend to try out, and that's the Zen 1-to-4, which is a higher THC ratio. Obviously, like you mentioned, Mark, 1 part CBD, 4 parts THC, and it is a sativa categorized cultivar, meaning more for the daytime. And when you talk to people about anxiety, you usually hear, no, I got to stay away from sativas. However, this one's very heavy in limonene, which is great for anxiety, and very little to no alpha pinene. So it gives you that uplift, as I mentioned before, without that super energetic surge, which can induce that anxiety. And it's great for the daytime. It won't make you too sleepy or heavy until it starts wearing off. Any THC product, once it starts wearing off, usually makes you very heavy and drowsy. That's a sign that you might need to take another dose to get that little pick me up during the day.
Right. And a good point to understand is, and I made it earlier when I talked about what's your program or your regime during the day. Uh, if you use a tincture product, like I use one in the morning, I know I'm going to get probably about 5 to 6 hours off of that. So if I start at, let's say, 8 o'clock in the morning, I know early afternoon, I'm going to have to do something or it's going to wear off. And in my particular case with herniated discs, they're not going to go away. And candidly, they hurt. So I've got to do something in the early afternoon. And then I've got to do something in the early evening to be able, if I'm using, again, if I'm using tinctures, I got to pay attention to the time frames, when, how long it takes, the onset and the duration. You also want to take a look at things like when you use a flower, for example, it'll usually last an hour, maybe 2, 3, but then you're going to have to, it'll wear off. And again, you go to the gummies, the capsules, and they'll last anywhere between 6 to 10 hours. So again, depending on your particular body and your therapeutic dosing level, what that means is how tolerant you are to THC, then you're going to be able to find a product that will work for you. And I think the answer in this particular question is yes. It's not going to be something right out of the box, but within a week or two, you can actually come up with something I think that can help. Is that safe to say, Manny?
I would completely agree. I would even emphasize even more so to make sure you journal, take your notes. And where most people make the mistake is that after maybe a couple of weeks, even a couple of months, you may notice that the regime that you're on, or regimen that you're on, is not actually as effective or efficient as it once was. The
Right.
body is very resilient and it'll get used to your regimen, and you need to change it up. And that's why that wellness line is so important, because we know your baseline terpene profile that works for you, and all we have to do is match that up to another profile that's out on the market, whether it's Surterra or anywhere else that you need to find your wellness.
Right. And also, your product gets better. I mean, CBD is known to be a neuroprotectant, which means it'll coat the receptors. And as your receptors
100%.
get better, you need less of it, and you may need a different mix.
Correct.
Cool. Let's jump on the next set of questions. Okay. Why does cannabis work so well the first time and never as good after that? That's a great question, man. That's one of those consultation questions, right?
Yeah, that's actually what I was just speaking to. It works so well the first time because your body's like, oh, what's this? You probably had a cannabinoid deficiency, you've replenished, and now the body acclimated and it just needs something different to keep it guessing. I've worked with a lot of patients that come in and they come back thanking me so gratefully because it's worked so well. And then a couple of weeks, a month or so later, they come back like, Manny, it's not working anymore. And we just got to go through that consultation again. We got to get those diving in questions, those fishing questions to get you the response, so I could figure out what works for you, or any guide or a person at a Surterra will be able to decipher that for you and help you out.
And I should point out, one of the things that's important is your body has an endocannabinoid system where you produce your own endocannabinoids. And what you're doing is you're in essence augmenting or helping by putting the phytocannabinoids in your body. You're actually putting endocannabinoids in your body that it can use. In essence, you're charging the battery, and those get stored in your fatty acids. And when your body needs the endocannabinoids, it reaches into the fatty acids, turns out to produce long-term fatty acids that turn into cannabinoids. That's how the process works. Now, every between 5 and 8 weeks, I usually take a holiday. The holiday meaning I don't use cannabis. I stop using it. Technically, the doctors will tell you should try to do that for as much as 4 days. In my particular case, because of the herniated discs in my neck, I go for about a day, maybe a day and a half, and then my neck taps me on the shoulder and says, "You better do something pretty quick, or you're going to get to know I'm here." Anyway, the point is, one of the other things is, if you take a holiday, what happens is your body doesn't get the help from the phytocannabinoids, and it says, "Oh wait, I have to do more work to get there," and it basically re-energizes and wakes up your endocannabinoid system. That's something that can also help as well. And not many people pay attention to what they call the cannabis holiday.
I
Your thoughts?
agree completely. I do that regularly, at least maybe once a quarter, every 3 or 4 months. I try to implement that, particularly when I notice that I'm not getting the same effects from the products I like to use. And even if I switch products, sometimes I don't get the effect that I'm looking for. So that's telling me I need to take what we call a tolerance break or a tea break.
Yeah, yeah. I call it a holiday, but yeah, just take that break. And I think not many people talk about that, but it's something that really helps your body to be able to adjust and get the most out of the cannabis product. And you use less product. It makes it more effective.
Saving money.
Yeah, save you money. I use an herbal remedy called lac corish to treat the hot flashes that accompany panic attacks and PTS triggers. Are there terpenes that can help? I think we put up a terpene profile. Manny, give me the terpenes that are going to help with anxiety, stress, which will also help with your PTS and panic attacks, right?
Absolutely. So those were limonene, pinene, caryophyllene, and linalool. Um, and again, we would like to try to mitigate that before those panic attacks happen. But again, come in for a consultation because I'm not familiar with that remedy. I'd like to learn about it and what it actually provides. Again, we are not medical professionals at the dispensaries. We are, however, subject matter experts and like to think of ourselves a little bit, for lack of better words, clinical in the sense that we like to dive deeper than just the categories of indica, sativa, and hybrid. So please come in for a consultation. We'd like to learn more about that, and hopefully we can help you out.
Yeah, and the answer is yes. Again, it's this journey. We need to personalize it and make sure we're getting the exact products that help you. Next question is: if a patient is already on antidepressants and anti-anxiety and antipsychotic medicine, is it safe for them to use medical cannabis? I believe the answer is yes. This is what Amy was pointing out during the slide that we had earlier. The products you have to worry about are products that have to do a lot with blood flow. It has to do with your heart and your blood system. Now, you need to do though is as you start using medical cannabis, you need to start using a lot less of the antidepressants, anti-anxiety medications. Specifically, don't stop cold turkey. Don't go from one day using an RX drug to a cannabis drug. Take a month to 6 weeks to kind of wean yourself off one and go to the other. And again, if you're working with a doctor on this, which you should be if you have a prescription, talk to them about it because in many cases they'll actually help you. It's surprising to me how many doctors today are actually recommending cannabis as an alternative. They may not know the exact prescription, but they do know that it works, and that's where people like Surterra, myself, and other folks come into place to help you figure out what's the right ratios and the dosing amount. Your thoughts, Manny?
I'd completely agree with that. I've heard so many different opinions from different physicians, MDs, and otherwise. So, but again, if you're on a prescription, work close with your physician. Keep in mind that we will always follow the guide of the physician, particularly if they put those notes in your medical marijuana use registry, which is the recommendation they submit so we can sell you products. But have that conversation with them, particularly because we wouldn't be able to speak too much on it, unfortunately.
Right. And I think and the mantra is go low and go slow. You don't start just taking it. Start with a quarter of that eyedropper, then a day or two, then go to maybe a half an eyedropper, see how you feel. Make sure you don't get too anxious. It doesn't, how should I say, contribute to it. Find out what your dosing level is. And as you're doing that, cut back on the antidepressants. It's a process to go through. And this is where journaling, write down what you're doing, will help you quite a bit so you can understand the cause and effect and then head yourself in the right direction to the relief that you're looking for. Let's jump into the next section. There's one prescription they gave me to treat COVID with steroids. The steroids cancel the effects of RSO indica. It says choco. I have not heard of steroids canceling the effects of cannabis, but it does. They do affect the receptors, and they can, in certain cases, counteract cannabis. Your thoughts, Manny?
I would tend and lean to agree on that. Some of the studies that I've done myself personally, steroids do play on some of the same receptors as cannabis, and as such, just like CBD is an agonist and kind of helps wipe the slate of THC, steroids possibly could. There are tons of studies still out there. We're still learning so much about this. And if you're having different effects after being off those steroids, that would be a good indicator for me to suggest that's accurate.
Right. I think the hard part is, and this is from our perspective, please understand there are a lot of different steroids that are out there that do different things. So when you say steroids, it's kind of like saying coffee. And I guess you got to understand, is this dark roast? Is it light roast? Is
There
it
you go.
Sumatran? There's a lot that goes into this particular question. And this is a great question that when you go into the dispensary, get a consultation on this because then you can nail it right down and really give you a definitive answer on it.
To that point, also, Mark, if you, I'm presuming RSO indica chocolates, maybe,
Yeah.
but any kind of cannabis that you're ingesting, your diet can affect how that affects you. If you're eating a big meal prior to taking a high THC or CBD product, it may take longer for that effect to kick in, if at all. If you take it right before a big meal, then it's a little bit different. So there's a lot that goes in with ingesting cannabis, and again, that's why those consultations are important.
Right. Right. Great question here. Do supplements interact with CBD? I just depends on the supplement itself, but I have not heard of any negatives or anything you have to worry about with CBD and supplements. And in fact, CBD is what I consider to be a super vitamin. Your thoughts, Manny?
Again, I agree. And it depends on the supplements as well. THC and CBD, as you mentioned and Amy mentioned in the presentation, is natural to the body like 2-AG and anandamide from our internal medicine cabinet, if you will. So, and what's also important is interact in a negative way, a positive way. When I see interact, I'm just thinking of interaction whatsoever. And I would imagine it could lessen the effect, but I don't see it making anything worse as there's very little contraindicators with cannabis as a whole.
Sure, sure. That's a good question. One good question here is, can I make and sell my own edibles? I think the answer is anybody can make and sell their own products. The question is how to do that legally. Here in the state of Florida, to sell a cannabis-based or a medical marijuana-based or a product that has more than 0.3% THC in it, although even if it's a hemp-based product, there are a lot of laws, rules, and regulations. I heard that it's a minimum of startup, just besides the license to be able to do that. And I'll not touch on that because there's a lot of politics behind it, but the actual physical setup costs to be able to do the testing for the state and the regulations is north of $5 million. Your thoughts, Manny?
I think I've heard it a little bit more than that. Um, However, to the point, if you could purchase the products or the necessary ingredients, if you will, from a local dispensary and make your own edibles, yes. However,
Yes.
selling it is a no-go in the state of Florida. And to that point, I don't want to insult anybody's skill set if you're a chef or otherwise. However, there's like you said, Mark, a lot that goes into it. There's a lot of liability that goes into it. As we all know, the vitamin E acetate vape crisis from the West Coast was somebody not knowing how bad something could be, and that liability comes down pretty hard when you have lives in your hand. So if you're going to do something like that, definitely find a state that's legal, do it the correct way, and make sure that you're going to take liability for whatever comes of it.
Sure. Now, uh, the word make and the word sell, those are two trigger words. So the word sell triggered our answer there. Let me take the word sell out of the equation. Can you make your own edibles? And the answer is yes. For example, I make my own brownies,
Mhm.
and they're great. So the answer is yes. Cooking with cannabis is very popular, and in fact, I think there's some recipes on your website, right? Right?
There are recipes on our website, and we're actually going to be. I don't know if I should let the cat out the bag, but as of tomorrow, I think that we're going to have a little special launch where we're going to have a little slip in your bag if you purchase this product to show you some recipes and how to go about using it.
Perfect, perfect. That's great. Okay, so let me jump to the next question. If a patient is on the autism spectrum and has severe bad anxiety, would the patient need to have had meds prescribed previously to qualify for a cannabis card? First of all, get a visit with your local with a local cannabis doctor. I recommend MMTC of Florida, but there are obviously other doctors that are out there. The reason I do MMTC is because they have 22 locations across Florida, and they do a very good job from the standpoint of working with the patients after they get their card. But I think the answer is yes, you should be able to qualify. You don't necessarily need to have meds prescribed, but you need to have the condition diagnosed. That's what the doctors are looking for. Your thoughts on that, Manny?
I've run into the same thing. There are clinics out there that will evaluate you, and if a diagnosis is found, they will diagnose you and recommend medical marijuana.
Mhm.
There's some clinics that are strict and say you have to bring medical records to show a diagnosis. And to that point, it doesn't have to be a said specific diagnosis of a qualifying condition to the sense of, let's say you have to have AIDS or you have to have cancer. If you have similar or like symptoms to those of a qualifying condition, you may be qualified as well.
Sure. Yeah, I know the herniated discs of my neck aren't covered. If you look at the 12 conditions here in Florida, it's not listed as one of them, but it does fall into the same category and the same symptoms and relief you need from things like MS.
Chronic malignant pain. Yes, sir.
There you go. What is the difference between CBN and CBG? That's a great question. I think we did a whole webinar on cannabinoids. You want to take that one, Manny? You want me to take it?
Well, I'll jump at it. That webinar I was going to suggest it could take a whole webinar to do. CBG is basically, if you will, the stem cell of cannabis. Is basically what all cannabinoids are derived from, depending on the light source, the temperature, the environment, or actually how you apply it in consuming it. CBN is actually more of a relaxing euphoric, but less euphoric than THC, where CBG is non-euphoric. And basically, actually, CBN is the conversion of delta 9 THC before it degrades. So the longer you hold on to a product, particularly high THC, the likely it'll convert into CBN before it degrades into something that you don't want to use. Hence why if you keep your vape cartridges or product in direct sunlight or higher than room temperatures, it starts getting very dark or if not black. And the darker it gets or the blacker it gets, the less you may want to consider using that product because of the age or exposure to the elements.
Yeah, yeah, and I should point out that CBG, when that plant, that seed pops up and starts growing, the first thing it produces is what they call CBGA, which is an acid, and then from there, the THCA, the CBDA, and the CBCA gets produced, and that's what produces the rest of the cannabinoids. So it's kind of a process that's out there. Where CBN is one of the cannabinoids that is produced in that particular process, and especially after a period of aging, it's there. Um, let's go to the next question. What type of which strain should I choose for insomnia? Which for daytime and still function as well? I think it's not only a matter of the strain, Manny. I think it's also a function of the terpene, right?
Absolutely. One of the products I would definitely recommend for insomnia is our 1 to 9 Dream. However, I would mitigate, as the question states, something for the daytime and still be functional. I would recommend either the 5 to 1 Serene or the 1 to 1 Revive, depending on the activities you're looking to get involved with. And then even the 1 to 1 Soothe in the afternoon to possibly mitigate the insomnia at night. But again, if the insomnia still kicks in, the 1 to 9 dream at night, which is where I would start you off at,
Yeah.
or recommend, excuse me.
Yeah, I think it's important that you pay attention to the terpene profile as well as the ratios, because that'll really affect it there. I know that as you mentioned, the same product ratio has different effects based on the terpene profile. So it's something to really take a look at. I would take a look a lot at using tincture oils. I think that'll help quite a bit to help you control it. Next question is, I'm interested in a product that will relax my mind without making me tired or lethargic. What do you suggest? I think some of this has to do not only with the product, Manny, but it also has to do with understanding your therapeutic dosing level.
100%. So in this instance, it sounds like having that right dose, whether it's a tincture or a gummy, whether you're cutting it in half or otherwise, is very important. Some of the products I would recommend to relax the mind without making you tired or lethargic. We actually have one-to-one vapes as well. We have one that's called Stupor Glue that's really good to help relax.
Mhm.
But it may relax you a little bit too much. And then we have another one that's called Flaming Cherries, which
Yes.
is great as a one-to-one as well, which is more your early afternoon to early evening time, possibly. It all depends on your therapeutic dose, as you mentioned, Mark, and how much you're inhaling, how much of a dose you're taking, if you're ingesting, your diet, your environment. There's a few things, but that's where I would start.
Yeah. And if you're taking a gummy, man, start with that quarter of a gummy before you take the whole gummy. I mean, just again, and give it 2 hours of work. Just again, you can adjust this. The nice part about cannabis is you're in control. The bad part about cannabis is you're in control because you really have to
Mhm.
find out what your particular therapeutic dosing level is that's really out there. Um, Next question, which is a great one, I'd love to know the answer to, which is how do I stop marijuana stigma? And this is the stigma that if you're using cannabis, it's considered to be bad, and that cannabis is bad. Um, I think when I got involved in medical cannabis 10 years ago, you'd have thought, especially in about 7 years ago when I moved into the community that I live in, and I told people what I did, they looked at me like I was Darth Vader. Um, Literally 2.5 years later, because I was working with medical marijuana treatment clinics in Florida, 182 of the folks of my neighbors got their card. And in fact, I went from being there to the stormtrooper where I can't even walk into the grocery store right now without being asked a question. What I'm trying to point out is I think there's really two things. I think, first of all, we've got to really educate as many people as we possibly can that cannabis is only it's a plant that acts as a medicine. It is not a drug. And because it's not a drug, that's why the pharma companies don't want to see it in existence. And I think the other is talk to people, and people will talk to other people. The folks that have used medical cannabis and been cured, have them tell their friends. Don't be shy. I've had some of my patients that just didn't want people to know they were taking cannabis, and I said, why not? Let the other people that you know benefit from this just like you did. It's something that we really have to, as a mindset, something. It's going to take a while. You can't go through 70 years of propaganda and turn it around overnight. But I see it changing very, very quickly, especially and we're on the verge of rescheduling cannabis from a Schedule 1 to, they say, Schedule 3. We'll see how it comes out. Your thoughts, Manny?
I'd follow along with that. I have a semi funny situation how I do it. But before I get into that, one thing, like you said, Mark, is be confident and talk about it. I'm a big believer in steel sharpens steels, and if you don't start with yourself, then nothing else is going to sharpen you.
Hmm.
Um, and what I do is I'm over 40 and I'm walking around wearing some of the funny cartoon shirts about marijuana, Cookie Monster with the big marijuana leaf. I have a shirt that says, "That's what I do. I smoke marijuana and I know things." I think that's a playoff of Game of Thrones.
Right.
And when I go out in public and do this and people approach me, or if I'm wearing a work shirt with my lanyard that identifies me as a dispensary person and people ask me, I tell them confidently what I'm doing. And at first, you see the slanted head, deer in the headlights look like, "Ooh, really?" And then you can see the calculation like, should I continue to talk to this person? This person seems like a really nice person, but they smoke marijuana and this and that. And the more you discuss it, the more you're changing minds, even if it's one person at a time. Just like if we're helping one person at a time during these webinars, then we've made a difference. And as long as you could do just that little bit, that's a start. Any motion forward is a good motion.
I know that just to give you an idea, Normal, which is one of the groups that works in the federal space to try to get cannabis legalized, has now done a study and found out that almost 80% of the people in the United States now are in favor of medical cannabis. So I think it's breaking down, because when I got in this industry 10 years ago, it was not even in the 70s, it was high 60s. So it is changing. Again, it's going to take a while, but I think it's something really that's out there.
The irony also, Mark, is that there's times where I'll see customers or patients in the dispensary, and all of a sudden somebody will recognize another person, and at first they're kind of embarrassed about it, and then they realize like, oh my goodness, well we're both here. I kind of related to some people. Me in particular, I always used to feel uncomfortable going to church and pray, and then finally, when I was younger, my mother told me, well, son, if you can't pray in church, where are you going to pray? And ever since then, that stuck with me. I was like, you're right. I'm among like-minded people. I'm safe. I'm where I want to be and feel comfortable. And as soon as you start noticing that in yourself, you're going to want to spread that. However tactfully you do it is completely up to you.
That's really good counsel. Next question is, what is the difference between high THC percentage, 25% or above, and high terpene percentage and content? First, I want to point out that the THC percentage is how much THC is in that particular product. For example, if it's flower, it means when you're burning it off, and that is one measure of the cannabis product. When you look at terpenes, terpenes come in much smaller percentages. If you see 5, 7, 8% terpene profile level, that's pretty high. In other words, terpenes aren't as predominant, but they are very potent. In other words, you don't need as many to really have the effect that you really want. So what happens is the terpenes are completely disconnected from the THC. THC is a strain. Think of it as the strain works with the receptor and gets the receptor to open up. The question is, what is it opening up for? It's opening up for the terpene that goes inside. So they work together, but there isn't necessarily a high THC product doesn't mean it's a high terpene percentage, and vice versa. Your thoughts, Manny?
I'd like to actually use my spaghetti and meatballs metaphor here. It's kind of like if you had two people getting Italian food, spaghetti and meatballs, the chef is going to serve you spaghetti from the same pot, your CBD, if you will, and then meatballs from the same pot, your THC, if you will. Now, some people like red sauce, some people like white sauce, and just because of that, they look different, smell different, and taste different. But to the point of the percentages, how much sauce do you really want on there? There is a such thing as having too much sauce on your spaghetti and meatballs. At least for me, there is. And then depending on that sauce, you might taste a certain ingredient more prominent than another. So not trying to make it too confusing. One of the things I like to point out is if you're dealing with the indica category of cultivars, I personally search somewhere between 15 to maybe 23, 24%, and I'm satisfied. And that's on the high end. And that's because indicas typically are heavy in a terpene called myrcene. And myrcene is very sedative, but it also allows THC to get through the blood-brain barrier to the brain a lot faster and more efficient and an abundant way. So you don't necessarily need those high THC percentages as long as you have a high myrcene percentage in the terpenes. Now, sativas are a little bit different. Sativas don't have as much myrcene, so for me particularly, I like to look for that 21 and above on THC percentage because I know it's not going to have a lot of alignment, or excuse me, myrcene, and that's my particular effect that I'm looking for. So there is a difference between high THC percentage and high terpene percentage. If you don't like the THC percentage on a product, definitely ask for the terpene percentage because the plant knows, hey, if I'm low on THC, let me raise up my terpene to make it more efficient. We don't adulterate any of these flowers, although we do try to cultivate them.
Right. That's really good. That's really good question. So let's run into the questions that have been submitted that were live. Jennifer says, I'm in Orlando, Florida. I have stress and anxiety, and I need to renew my medical marijuana card. Jennifer, I'd recommend that you go to the Medical Marijuana Treatment Clinics of Florida, MMTC of Florida. Their website is www.mmtcfl.com. They have a clinic in Castleberry Not only can they help you with anxiety, stress, and also get you a card for HIV, they have great post appointment support. I think that's what's really key to a lot of this. Anybody can get you a card. The question is, once you get the card, where do you get the help with the dosing? Where do you get help with? Can you reach? Can you reach? Get information from the doctor? Can you get the support that's there? Do you have email follow-ups that give you timely information on how to use it based on your journey? MMTC is heads and tails above everybody else. So I'd highly recommend that. That's out there. Hopefully that will get you your card. And again, it's in Castleberry, which is not too far from downtown Orlando. Michael asked
Now,
a question. I'm sorry, go ahead.
is this a play on words a little bit? Because if it's the medical card, you could do that online. If you need a new recommendation, then I would
Ah,
highly recommend MMTC. But if it's just a card, you could do that online yourself, or you could go to a Surterra and they'll help you with that free of charge.
yeah, great. Oh, yeah, that's right. I forgot to point that medical card meaning from the state and that type of thing. Right there. Next question is, I've always stayed away from sativas because I thought they could cause anxiety. Which sativa strains are good for anxiety at Surterra? I think, again, this goes back to what you recommended and also the terpene profile, right? Right, Manny?
Absolutely. I would definitely start off with Zen, the 1:4 ratio vape product. Again, I say vape if you're vaping because it's fast in. If you don't like the effect of it, it's only going to last about 30 to 45 minutes, maybe an hour or so if you're new to inhaling. If you want to ingest it, that also comes in tincture as well as uh, the Pro that you see there, the twist dispenser on the left, and then also the vape pen. That's a great product. And as you can see from the terpene profile there, limonene, myrcene, which is actually relaxing to kind of counteract all that limonene, then caryophyllene, which is great for pain, and then that alpha pinene in small amounts, which is to say suggest that it's keeping you awake so you don't get so tired. But that's
Sure.
definitely a great product to start off with.
Great. Good counsel. Cheryl had a great question. What would starting dose for TBD tincture? I think the question is what dose should you start with? Again, this is that start low and go slow mantra. I think starting with a quarter of an eyedropper and trying that for a day or two and seeing would be the way to go, and then moving to a half an eyedropper for a day or two, and again just monitoring, making see if you're getting the relief, and until you get to a potential point where it may be you may have passed that therapeutic level. Your thoughts, Manny?
I would agree on that. However, CBD can be slightly different because CBD is non-euphoric and because it takes a longer time to preload in the body. Average dose again is 7 to 12 milligrams on CBD or THC, particularly THC. So we would normally consult or recommend half the dropper, 5 milligrams, depending on the terpene profile of it, whether it was day or night. Typically at night, 5 milligrams is great because you need that little bit extra and to keep you asleep. Whereas the daytime, we normally recommend a 2.5 or a quarter of the dropper.
Yeah, good counsel. Thank you.
Well,
Kathleen Knack is how healthy is vaping? Vaping got a bad rap by some basically products that were brought into the West Coast that were not tested. Manny, I'm going to let you tackle this one because you, as a Florida-based medical marijuana dispensary, go through two tests in-house and one test in a third-party firm outside your firm. It is very
that
safe if you buy from a dispensary. But I think I'll let you tackle this one.
Yeah, that's absolutely correct. I always tell people liability is key. Dispensaries go under strict testing protocols to where we have to provide a legit certificate of analysis or COA, and we can have that available upon demand. That goes to show that there's no heavy metals, pesticides, mycotoxins, so forth and so on. So getting it from a dispensary, there is liability, and it is, I can only say, relatively safe. There's nothing in this world is 100% safe. However, there is vaping etiquette. And what I mean by that is a lot of people get irritated lungs or throats or a lot of coughing and irritation because they're vaping wrong. And what I mean by that, vaping is not like smoking. You don't want to draw on that vape like you would a joint or a blunt or a water pipe because it is a concentrated form of what you would normally smoke. So 2 to 3 seconds, very slow. You should barely feel it tickling the throat going into the lungs. And then once you're done, pull it away, inhale or your depth of breath as much as you can tolerate, and then slowly exhale. Do not hold your breath. And any irritation or anything that occurs from that should subside within a few minutes. And that also is to say that the oils that are in our vapes are pure and that our tissue, our bodies can't absorb any residual, but not that there should be any unless you're taking these huge clouds, which again would be the wrong etiquette.
Now, I think it's important to point out vaping is much healthier and safer than smoking flower, for example. Vape is much safer than the flower products, because the flower products have burnt material, or vape doesn't.
Correct.
Okay, okay, let's
Now
go.
that I'm sorry, Mark, that I forgot to mention, vaping is not just oils or liquids either. You can also get a dry herb vaporizer, where you would grind up about a gram of flour, half a gram to a gram, put it in there, and it heats it up like an oven, evaporating the trichomes off of the flour, which is where the medicine's at. Therefore, you're not getting the carcinogens or burnt materials, and you're not up at 500 degrees either. You're more around 240 to 300.
Mm, great. Shirley, you asked a great question about the website. The website that you want to go to is marijuanaaware.com. The YouTube channel that you may want to take a look at is also Marijuana Aware. It's youtube.com/@marijuanaaware. And we have, again, all the videos from like tonight, the video itself, the questions and answer, the whole seminar itself, all out there, plus other subjects, other topics that are out there. We're doing one for sleep in a couple of weeks and that type of thing. You may want to take a look at that. So I hope that really helps with that particular question. Richard asked, how about a 2-to-1? Do they make one? That's right up your alley.
Absolutely. We have one in store in our Wanna Choose. It's called Yuzu. It's a 2 to 1 ratio. Great product for the daytime or nighttime. Won't really keep you awake. Great for that inflammation, stress, anxiety. May have very slight euphoric effects, but not too much the more you use it.
Yeah, good question. Carol asked a question, what is 1 to 9 flower vape? I think this is the ratio. I think the first number that you always see is the amount of CBD in it. The second is the amount of THC. It makes no difference if it's flower or vape. I think that's the ratio that's there. And your comments, not Manny?
That's 100% correct. The 1 to 9 is not in a flower. It is a ratio, a high indica category cultivar, if you will. It comes in relief and in dream. Now, the difference between the two, again, is the terpene profile. Relief is going to have more caryophyllene in it, which is your natural analgesic or pain relief, whereas dream won't have as much. So 1 to 9 relief, more for pain, relaxation, and or sleep, whereas dream is just going to be for relaxation and or sleep.
Right, right. The next question, I think, is more of a comment. I think Keith made a comment that he can't go without THC for 1 day. That makes some sense. But again, if he changes products, it acts like a vacation. Again, you're resetting a lot of your body with the terpenes and the strains that are there. The vacation works because it recharges your body. I think that's something you may want to take a look at. But if you can't go without THC for a day, this may be an option. Your thoughts, Manny?
I can relate considerably. So there, for the most part, that's why I don't take a vacation or a holiday or a tea break as frequently as some people do, because it's quite unbearable for me to go without THC. It's the
Mhm.
amount of THC I administer to myself throughout the day. But you're absolutely right, Keith. The only thing I would suggest that if it ever stops, then you may need to get into that vacation period, and you can take CBD during that vacation to get loaded up. But I would do it prior to the vacation so you're preloaded. Come
Sure.
see us for a consultation. Regardless of where you're at in the state, we'll all be able to help you at any Surterra.
Right. And I think the last question we have of the night that we're running into is a good question by Robert. I take Plavix and do edibles. I have read a lot of reports that state mixing cannabis and Plavix is a no-no. Is there any more data that you can recommend reading Of course, my doctor has said not to stop taking cannabis, but she doesn't approve. I'm not really sure how much testing has occurred on the reactions between these two drugs. First of all, make something really clear. Cannabis is not a drug. Cannabis is a plant that acts as a medicine. Plavix is a drug. And the real difference is one of them is natural-based products that are compatible with your body. The other one is a pharma-based drug that's introducing something foreign, something your body doesn't make, to your body, and then you're hoping that they're getting the appropriate reaction. Like, that's an important distinction because that has a lot to do with do they react together? I think your doctor, in defense of many doctors, they're not taught about the endocannabinoid system and they're not taught about cannabis. So in many cases, doctors just don't know, and they're not going to take the risk. They're not going to risk their medical license in their practice because of something that they don't know. So they'll either not recommend it at all or just kind of take a position of, well, that's up to you type of thing, which it sounds like your doctor is taking. Now, to your question of how many studies are out there, again, if you're using edibles and Plavix, this is where you want to journal. Just want to keep track of what you're doing. Make sure you're paying attention to the amount of dosing that you're using. And you may want to also reduce the amount of Plavix you're using as you go forward because it may help you. Again, getting off the pharma drugs. Now, that being the case, I am personally not aware of many studies between Plavix and cannabis. However, I do have to tell you there is more education going on right now, or most studies, excuse me, going on right now in medical cannabis. Last year, we did more research on the subject of medical cannabis than has ever been done in all the years before. That's how much it's really taken off. And that's exploded. It's supposedly going to explode this year. Now you're saying, where are these studies done? They're being done outside the United States. Israel is huge on this. We actually funded Israel to get them started in this. Canada does a lot. You'll see a lot out of Germany. England has a number of studies. South Africa. So these are happening. Actually, Australia has a number of studies. So cannabis is being studied internationally, Europe, as well as Asia. And so we're beginning to get more and more studies. Robert, I will actually keep an eye out to see if there's any specific studies on Plavix and edibles. I think in the short term, my advice would be do some journaling and pay attention to the cause and effect to make sure you don't have any reactions. You got any comments on that?
So, not too much, because as I mentioned before, we're not medical professionals. However, one of the sites that I go to for my personal use, as I do with my own and my son, who's an adolescent using high CBD products and minimal THC products for his epilepsy, I found that Penn State College of Medicine has put out not information, but where you can look up for cannabinoid and drug interactions. That's
good.
what
I
I
didn't know about
use
that.
personally.
Yeah.
You were saying, Mark?
Why don't you send that? Why don't you send out that URL to us, and we'll actually include it in the notes as a follow-up.
Yeah, absolutely. I'll send that to you before we conclude this evening.
Sure, that'd be great. I think that'd be good. I think that's something that maybe, like I say, there's a lot of, again, this is where Penn State is not doing the research. What they're doing is they're cataloging the research, and I think that's important. There's a lot of that going on right now that we're beginning to see. There's libraries being built. Any other
Yeah,
comments?
absolutely.
Any other comments on that subject?
No, not for me.
Okay, great. So, Manny, we have talked a lot about anxiety, stress. Any thought, any last minute comments you want to make?
So as I mentioned before, you definitely want to get that consultation. Start low and slow. It's not always necessarily high THC. Those who avoid sativa category cultivars because of anxiety, definitely get that consultation, because if we can mitigate some of your stressors and anxiety during the day, you'll probably have better sleep at night if you're suffering from that.
Yeah, what I want to point out is I want to thank everybody, first of all, for joining us. It's been a long webinar with a lot of good questions. And again, you'll get a follow-up email that'll have a link to the video, a link to the presentation, follow-up information like the URL we just talked about for Penn State. It'll all be in that video, and you should get that within the next day or two. I do want to point out that we have a number of events. First of all, we have the webinars, which you see in the burgundy colors or purple colors. And we're doing that again on Wednesday nights. And then we're doing a couple of live events. So if you get a chance to join us, please do. We'd love to have you see you in person. And more importantly, There's a number of places out here that we can help you with your particular condition. Anyway, thank you very much for joining us.